Thank you, Dr. Angita and Sahani sir. Good evening, good afternoon, and good morning. This is the 1440th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session. Today, our guest is Dr. LUBNA Kamal. Let us begin the session with 1 minute silent prayer. International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have three sessions every day from 7:30 to 8:30, the international Hindi session, and 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, a local language session in Malayalam. All these sessions are going in a good way, and we have lot of international faculties presenting different papers in all these forums, and that's the beauty of our forum. And we have a wonderful personality from Uttar Pradesh, is our guest, Dr. LUBNA Kamal. She has completed MD Homeopathy, MBA, and PhD. She is working as an associate professor, Department of Materia Medica. That's a very important thing. State Jawaharlal Nehru Homeopathic Medical College, Lucknow, Uttar Pradesh. Dr. is a homeopathic nephrologist and the one of very few in the world with experience spending over 2 decades. And she, along with her team, have treated over 21,000 patients suffering from renal failure from all over the world, for which she has been awarded by Influencer Book of World Record. Her research paper in the International Conference of Liga in 2021 was the only one from abroad from the world of treatment of renal failure. And she has done a lot of work during COVID time, and she has appeared in different talk shows and interviews at various TV and medias, and she has qualified the pranic healer, a dream analyst, medical astrologer, relationship coach, TV debater, journalist, editor, author, writer, gender activist, peace activist, public speaker, and so many, and including social activity as activist. She utilized her skill to heal her patient holistically. Very recently, she has attended an international meeting of nephrologists from different part of the world at Trivandrum and Kanyakumari, and that is also very excellent one because the almost all the participants are from the other side, the typical allopathic doctors, but only very few homeopathic doctors. The only one participated on behalf of homeopathy is Dr. LUBNA Kamal. Anyway, congratulations for that. Also, she recently presented a paper on Sharda Krishna Homeopathic Medical College, Kanyakumari, and White Memorial Homeopathic Medical College. So let us proudly welcome our guest of the day, Dr. LUBNA Kamal, and she has presented a different paper last time, and today it is the second part. As you know, the importance of one that is in homeopathy. So let us proudly welcome the guest of the day, Dr. LUBNA Kamal.
Thank you so much, sir. Am I audible?
Yes, you are audible.
All right. Hello, everybody. I'm Dr. LUBNA Kamal, sir has already introduced me. And this is the second part of the series that I've already presented. And it is about WHOQOL, which means WHO, World Health Organization, Quality of Life Assessment Tool. So what is its importance? Why are we talking about it? I'll tell you that in homeopathy, probably this is the tool through which you can assess anything and everything, any kind of disease, and you can publish your research, and such a research will be, accepted anywhere in the world, because this is a global thing. This is accepted all over the world. So if you are treating a patient, why is this important for homeopathy? We have already discussed all of that, but I'm giving a little brush up because there might be some people who might be new to this. So no matter which disease you are treating, if you do not have even the reports, still with just this questionnaire, with just this assessment, you can publish world-class research. So that is the importance of this questionnaire. And individual doctors, polyclinics, medical colleges, all of them should make use of this. It is so very important. Now, what is quality of life? We have already discussed, but I'll just brush this, that quality of life means an individual's subjective perception. How am I feeling? I might be very rich. I might be apparently very happy, but I might not still be satisfied with my life. So that is what quality of life is about. It includes a lot of things: the physical, the psychological, social, environmental, everything that is around us. It leads to the quality of life. I'm not going into all of these details, but this slide is very important. Why is it important in homeopathy? Quality of life in patients with chronic diseases. We, as homeopathic doctors, we are treating so many chronic diseases. And I was just as Dr. Danish had mentioned, that I was in Trivandrum for an allopathic nephrology conference where I was allowed to speak. So this is something which was very easy to explain to them also, that with homeopathy, we are improving, I am able to improve the quality of life of the patient. Quality of life who has undergone transplant, quality of life of a patient who is undergoing dialysis. Those people, those patients, they feel like committing suicide. They are almost depressed, suffering from so many emotional troubles. So that is where especially homeopathy comes into play, because the moment you give similimum, the patient starts to improve, whether their pathological reports improve or not. So in all of the chronic diseases you are treating, quality of life is important. And if you use this tool, then you can actually come up with a research. Then quality of life in cancer survivors. The patients who are even undergoing radiotherapy or chemotherapy or surgery for cancer, even if it is cured, even if they are cancer free, then too their quality of life might not be okay. But with homeopathy, because I have treated a lot of cases of cancers where the mass remained as such or it did not improve, but the quality of life of the patient definitely improved. Then quality of life in elderly population. Again, this is a huge area where homeopathy has a lot of role to play. Now, quality of life in elderlies, again, it becomes very important because their abilities are limited. So how to make them happy, how to make them satisfied with their life at that point of time when they are 70 or 80 or maybe 90 years old. So homeopathy can definitely do that. Then quality of life in mental health disorders. Again, homeopathy has great role to play. We received so many patients suffering from anxiety disorders on allopathic medicines. So their symptoms might be controlled, but they are not happy with their lives. Their quality of life is poor. But the moment you put them on homeopathic medicines, their quality of life starts to improve. So anyone working on any of these diseases can make use of this questionnaire, and with practice it is very easy. So the key components of quality of life, it is not just the physical symptoms or the physical illness, the psychological well-being, the social relationships, the environmental factors, material well-being, personal fulfillment, all of these form parts of quality of life. I am skipping these slides because we have had discussion on them, and someone who's interested, they can go back on the YouTube channel and just go through the previous video. Now, what is exactly WHOQOL, or World Health Organization Quality of Life Questionnaire? So
Doctor, slides are not moving. You have not.
it refers to a series of instruments developed by World Health Organization to measure an individual's perception of their quality of life. Now, it includes physical health, psychological health, as we have already discussed, the environmental health, and the social relationships. What are the benefits? It is a very comprehensive assessment. There are just approximately 25 to 30 questions, but they help to assess everything about the quality of life. Then it is a very standardized measurement, because the WHO scientists had been working on it from since 1980s, and it is a very precise and standardized measurement. Then cross-cultural applicability, whether a patient belongs to India or the US or maybe Africa or Australia, the questionnaire is valid. It remains valid everywhere. Then the policy, program evaluation, the patient-centered care. I think I've already discussed all of this. So I'll quickly slide through these slides and quickly we should come. Now, this is a sample of consent form for conducting this research. And you can see your name, your organization, the doctor's name. Your name means the doctor's name, their organization name, the clinic's name, the address, the city. Everything has to be mentioned on the questionnaire, which is received by the patient. The date has to be there. And this is a typical consent form. It can be downloaded. And then the patient has to read all of this. If they are not able to understand, then you have to explain it to the patient, and the patient has to sign it below, and they have to put their date. This is something very important, without which you cannot conduct the research on the patient. Now, the most important thing about is informed consent. What you are going to do with the patient, you have to inform the patient beforehand. Then the privacy and confidentiality. This is, we all know about this. As we know the importance of privacy, we cannot communicate what a patient tells us to anyone, not even their family, not even their spouse. So this questionnaire also is like a private tool. Whatever the patient is going to tell you, you do not have to tell it to anyone else. Then the third point, which is the voluntary participation. So you cannot bribe someone, you cannot pay someone, you cannot force someone to do this for you. The participation for this research has to be voluntary. It has to come from within. The patient should agree to it voluntarily. Then the cultural sensitivity and diversity, as we have already discussed, it is applicable to all the cultures across all the countries. Institutional review board approval. This research studies involve the administration of WHOQOL questionnaire should obtain appropriate ethical approval from an institutional review board or an ethics committee when it is being conducted in a hospital. Then transparency and reporting, you cannot manipulate the results, while it has to be it has to remain transparent. I'm skipping this slide. domains of WHOQOL, we have already discussed all of these in very detail and all possible details. It measures the physical health, the psychological well-being, the social relationships, and the environment around us. Now, again, I am skipping all of this. Now, this is, okay, we'll discuss a few of the points. That time and administration, actually, this will take some time. So it is important in the sense that if you are able to spare some time, or if you have someone who can conduct this test for you, then of course, it is very useful, but yes, it will take some of the time. Then limited contextual information. The WHOQOL instrument provides a broad assessment of quality of life across multiple domains we have already seen. Cultural and linguistic adaptation, you have to explain. Now, the patient belonging to some other country or having some other language, it becomes a little difficult to explain certain terms to them or certain questions. Then subjective nature of assessment. The assessment of quality of life is inherently subjective. You cannot scan a patient whether they are telling the truth or not. It has to come from the patient itself. Whatever they tell, you have to rely on that. Then there is influence of social desirability bias. When individuals complete self-report assessment, they may be influenced by social desirability bias. Yes, there's a proportionate bias always existing in all such kind of studies. Now, WHOQOL and counseling, why is it important for counselors? Even we as homeopathic doctors, we also counsel our patients. So initial assessment, at what stage the patient is, you can very easily use the questionnaire to assess that, and then only you can speak to them, because you have a rough idea of what is going inside the patient's mind. The other important thing is goal setting. The WHOQOL instrument can aid in goal setting during counseling sessions. What is ultimately that you want? So this is also important. Then treatment planning. Of course, if you have the initial picture of the patient, then the subsequent treatment and everything becomes easier. Monitoring progress, again, this is something what WHOQOL is about. Monitor, if you keep on monitoring a patient, say, of arthritis, they are depressed when they come to you, they are in extreme pain, they are not able to move about. But in 2 months of time, even if their pain is not like completely okay, if they are not completely cured, yet with homeopathic medicines, their quality of life will improve. The patient will be definitely happier. So, and the next thing is the outcome evaluation. At the end of the counseling or therapy or homeopathic treatment, the WHOQOL instrument can be used to assess the overall outcome and effectiveness of the counseling process or the therapy or the treatment. So this is true for all the chronic type of patients we have, and we treat them. Then its role in young adults, quality of life in college students. This instrument can be used there. Then quality of life in youth with chronic illnesses. Suppose there's a child, there's an adolescent, 16-year-old who's undergoing dialysis. Now, what his mental state is going to be? Or we see young people undergoing chemotherapy and all. So this proves to be very useful to assess the quality of life in youth with chronic illnesses. Then the third point, quality of life in young adult cancer survivors. I've already told about it. Then quality of life in transition to adulthood. Lot of psychological, emotional, and physical problems occur at this particular junction, where there is a transition from a child to a teen to adulthood. So the WHOQOL becomes very important. and handy at this point of time. This is about the quality of life among lesbians, gay, bisexuals, and transgenders individuals. I don't know how many of you ask the patients, but this is something very important to assess and to ask the patients, because they do not tell you, they will not tell you, at least in India, they will not tell you about this by themselves. But yes, this should be asked in all the questionnaires whenever we are taking the case, because this is something very important and it is very easily missed. But there are a lot of things, there are a lot of emotions associated with it, so it becomes very important to know this while you are treating a patient, no matter what disease you are treating. Then quality of life and sexual minority stress, and quality of life in gender minority populations. Then quality of life in survivors of interpersonal violence. I am just skipping this, although this quality of life in post-traumatic stress disorder is very important for homeopathy, because we get a lot of these patients. Then the COVID impact, again, quality of life was so important. Everyone was pushed inside their homes. They were locked up. So what happened after that? How the quality of life has changed? Again, this is something very important, and the use of this questionnaire there. Exploring mental health and well-being during the pandemic. It's all about COVID and coping strategies and what all we did. So comparing the impact across cultures and countries. Now, where all is this important? I've already discussed this. It is for health research. It is a very, very important instrument for health research, because the impact of disease, its treatment, its interventions, health-related factors, it all can be measured by using this. Then in clinical practice, as I already told, then that even if you do not have reports of the patient, the pre-treatment report, the post-treatment report, still you can publish a very good quality research paper using this. Then program evaluation, there are certain programs where it's the policies and all the interventions, they can be assessed very easily using this. Then public health surveillance and cross-cultural research. Now I am skipping this slide and I want to come straight to the questionnaire, otherwise there won't be any time to discuss the questionnaire. I want to show you all the questionnaire. This is the sample report, how it looks like. This is the scorecard. This is how numbers are given for each of the questions. We'll see this further. This is the questionnaire, and this is
hello, doctor. Hello.
Yes.
The slides are not moving. Still, it remains on the first slide itself.
Slide is not moving.
Yes, it's not moving.
You cannot see the questionnaire in front of you?
No, nothing. Only the first. Now it is.
Now it is visible?
Yes.
All right. Okay. Now is the questionnaire visible?
Yes.
All right. So the first question is, now this is the questionnaire, and you can see how simple these questions are and how easy it is to give the grades. There are numbers from 1.
Some squares. We can see some square.
Pardon?
We can see only some charts.
Yes, but whatever is written inside, can you see that?
No.
Why is it not visible?
Please enlarge the same.
Huh?
Please enlarge the same. Otherwise, we are not unable to see.
Actually, there's this fine print. I cannot enlarge it right now.
Okay.
So I'll just read out the questions. You have a rough idea what a WHOQOL questionnaire looks like. So on the left, there are the questions. On the right, there are the numbers where from 1 to 5, where the patient tells you, and you have to give those marks to the patient. There are numbers from 1 to 5, 1 for very poor, 2 for poor, 3 where it is neither poor nor good, then 4 is for good, and 5 is for very good. The first question is, how would you rate your quality of life? So when you ask this patient, this question to the patient, how would you rate your quality of life? So a patient who is actually happy despite cancer, despite renal failure, will obviously say that their quality of life is good or maybe very good. While someone who's depressed, who's unhappy, will give a lower rating. So this is the first question. And in some cases, you might have to explain about what the quality of life is. So the theoretical part was all about that, for a doctor to understand what quality of life is, so that they can explain it to the patient, and then only the patient will be able to answer. Then the second question is, how satisfied are you with your health? So this again is a very simple but a very tricky question, because at times cancer patients say that, oh, I'm satisfied with my health, I am okay. But a patient with a very trivial ailment might say that I'm not satisfied, I'm not able to move about the way I used to move about 5 years back. So again, that is their perception of their health. And this changes actually with treatment, with counseling, or with whatever therapy. This perception changes. The condition might remain the same, the disease might remain the same, it might improve or it might not improve, but the perception will change. Then the third question is, to what extent do you feel that physical pain prevents you from doing what you need to do? This is a very important question. Why? And now the grading is like 5 marks for not at all, 4 marks for a little, because this is the second set of questions, and then moderate for 3, very much for 2, and an extreme amount for 1. So this is something, a very simple question, I suppose, that because some people have physical pain and they feel that they, until and unless the pain subsides, and these are the symptoms of the materia medica, until and unless the pain subsides, the patient says that I'm not able to do anything at all. While there might be other patients who are having pain of maybe renal calculus or ureteric calculus, and they might be carrying on with their life. Even if they are in pain, then too they keep on carrying on with their lives. Then the fourth question is, how much do you need any medical treatment to function in your daily life? Now, this is about popping pills, that how many pills or how much of medicine, or what do you have to do in order to function normally in your daily life. Because there are people who pop several pills. They take one antidepressant, then they take anti-anxiety, then they take some PPIs, then they take some painkillers in order to feel absolutely okay, to maybe go to their office, or maybe go out and do something. So this question is about that. Then the fifth question is, how much do you enjoy life? Again, this is absolutely based on the perception, whether they are enjoying their life or not. And it is absolutely independent of what they have. A person who's very rich might be not able to be able to enjoy their life, while we see the kids playing along the road, and without any toys, without any expensive toys, without any gadgets, and they are enjoying rains, and they are enjoying life like anything. Then the sixth question is, to what extent do you feel your life to be meaningful? whether it has some purpose, whether it has some meaning. So a person who is insightful, whether he has something or not, they will of course say that, yes, I feel that my life is meaningful, it is full of purpose. The seventh question is, how well are you able to concentrate? Because when someone is depressed, when someone is anxious, they lose their capacity to concentrate, and it is a very important part of being healthy. So this again is a very simple kind of a question, but yes, it has a lot of depth. Then the eighth question is, how safe do you feel in your daily life? So how safe do you feel in your daily life? Do you feel any threat of any kind from anywhere? The ninth question, how healthy is your physical environment? So this is another set of questions. And how healthy is your physical environment, like the people around you? How safe do you feel in your surroundings, or your neighborhood, or regarding your family? Then the 10th question, do you have enough energy for everyday life? Now, this is a very important question, because all those people who are moving out, like I have a clinic in Delhi also, and there are my patients who move from their home at 7 or 8 a.m. and they enter the house at 10 p.m. or 9 p.m. And they simply say that they do not have energy for anything. Even if they have to come, like I visit the Delhi clinic on weekends, and they complain that they do not feel like getting up from the bed because they lack so much of energy. So this is a very important question. If we keep in mind the hectic lifestyle we have today, even children on a holiday, they say that I do not want to do anything or go anywhere, I just want to sit back or lie down in my bed. The 11th question, are you able to accept your bodily appearance? Again, this is a very important question. What are people doing to themselves? Undergoing surgeries, undergoing going below the knife. They have such distorted appearance. They want to have good hair, good skin. And despite that, they might not be happy. So this again is a very important question, and this is something we need to ask our patients. Have you enough money to meet your needs? Now, a poor patient might say that yes, he is satisfied with whatever finances he has. This is absolutely again a perception based thing, that you might be having money, you might not be having money, and then you might be happy and you might not be happy. The 13th question, how available to you is the information that you need in your day-to-day life? There is a term called FOMO, F-O-M-O, fear of missing out. We are gathering so much of information that we do not need, and we still feel that there is more and more we need. So this is about information, and this is what is happening today. The 14th question, to what extent do you have the opportunity for leisure activities? I do not know how many of you are doing it, but when I interview my patients, most of them who are in job or in business, they do not get time for their leisure activities, even if they are earning a lot. They do not have time for themselves, what they want to do. And this is a very important question. Even if when I'm not using this questionnaire, I ask my patients about this. So all of these questions are something you can use in your daily practice. The 15th question, how well are you able to get around, to move about? The 16th question, how satisfied are you with your sleep? Especially the patients who are on sleep medication, though they might be sleeping for 8 hours, they usually do not wake up refreshed. So again, it's a very important thing that how are you feeling about your sleep, whether you felt that your 5-hour sleep was refreshing, it gave you the adequate rest or not. The 17th question, how satisfied are you with your ability to perform your daily life activities? Because why? Sometimes we procrastinate, we try to delay the things around us, the normal daily activities. So if you are constantly doing that, then of course there will be deep dissatisfaction that this has to be kept over there, but I did not do it. And this is again part of your health. The 18th question, how satisfied are you with your capacity for work? Because there are at times patients or even students that they know that they are very intelligent, they are able to, they have the ability to do a lot of work, but due to some reason or the other, they are not able to do that much of work. So they are not satisfied. This question is about that. Then the 19th question, how satisfied are you with yourself? Whether you are satisfied or not satisfied. The 20th question, how satisfied are you with your personal relationships? That is the people around you. How is your relationship with them? The 21st question, again, it's a very important question. How satisfied are you with your sex life? The 22nd question, how satisfied are you with the support you get from your friends? Because if you will have a healthy group of friends and if you are connected to them in a healthy way, then only you are going to be satisfied with the support you get from them. The 23rd question, how satisfied are you with the conditions of your living space? The 24th question, how satisfied are you with your access to health services? Whatever health services are around you, because there are some patients who always feel that I do not live near SGPGI, that is why I am not healthy or I am not recovering well. Had I been to some big hospital like Medanta or maybe Amrita, they feel that then is when I would have been absolutely okay. The 25th question, how satisfied are you with your transport? If I'm using a public transport, I'm constantly dissatisfied that I have to use a public bus or maybe a local train. Had I not been in this local train, I would have been happier, I would have been more satisfied. This is what some people think and they feel. Then the 26th question, which is the last question, how often do you have negative feeling such as blue mood, despair, anxiety, and depression? How often do you have these kind of feelings, like once a month, once a week, or maybe once a day? So there are, if you see on the right, there are columns and you have to mark those columns, the number inside, and then you have in the next slide, I'm going to show you. This is how you are going to give score to the patient, and this score will improve when the patient's mood, the patient's perception, that improves. So you give them marks, and then after a few months, after maybe 1 month, 2 months, or 3 months, as the frequency is required, you can give them marks again. You can assess them again with the questions. You can change the order of the question. The patient might read the questionnaire themselves, or you might read the questions to them, and you can give them marks, or they can give the marks by themselves. And then is when you can assess it and you can give them marks, and you will come to know how far have they improved. So this is all about today. And this is the questionnaire I wanted to show to the homeopathic fraternity. And if there are any questions, I would be happy to answer. Because this is a relatively new thing. Most of us do not know about it. So I think there's some more discussion required. So if there are any questions, if anyone wants to ask anything, they can go ahead. Anyone? Anyone wants to ask any question?
Yes, doctor, please wait. We can make this thing. Those people who want to talk can talk to Dr. LUBNA Kamal. It's a very, very interesting as well as very important session it was. That all these things were there in the research methods, and the WHO has put forward such things. Unfortunately, most of the doctors are not aware of all these things. And this is the first time we people are hearing such things, and we are looking at. This is the beauty of your presentation, because you are always searching something and giving something that is not known to us. That is a great thing. And this kind of things will lead, definitely bring the quality of homeopathy to higher levels. And definitely all the doctors need to follow these laws, and this questionnaire is a very important thing, and we will circulate it among doctors to study these things. Okay, those who want to participate in the discussion may please raise your hand, and those who want to have a question can also raise your hand. Yes. Doctor, please introduce yourself. Motto G7. Please name yourself, doctor.
I am Dr. Deshpande from Lucknow.
Okay, sir.
Yeah.
Yes, sir, please go ahead.
Yes, sir, you can speak now.
I have just joined, sir.
Okay.
I have just joined the meeting.
Oh, sorry. Sorry. I thought that you want to speak to our doctor. That's
I have
right.
just joined. Yeah.
Doctor, what was the subject you presented at Trivandrum?
So it was this renal failure, the scope of homeopathy in this management of renal failure. And with this, I mean, the quality of life concept, it was very easy to explain to allopathic doctors because they are not aware of homeopathy. They, as usual, they think that homeopathy is just placebo therapy, and hardly there is anything which can be done with it in the renal failure. So when I told them that really you can improve the quality of life of the patient, they were like convinced with that. They were able to understand that, yes, of course, if a patient is undergoing dialysis for a very long time, or if the patient has been through transplant and their transplant got rejected, then of course there is great depression, helplessness. So the quality of life there, I told them that it can be improved. So that is something that they were able to understand.
Okay. Then what was their reaction? Whether you say presented some successful cases or evidence-based presentation was there or not?
Yeah, There were cases, there was, the research paper, and some of them, they were very happy to hear about that. Some of them were actually inquisitive to know more, but some of them were very annoyed that what a homeopathic doctor is doing in an allopathic conference. So there were doctors from all over India and other parts of the world. So there's a conference going to be held at Jipmer end of the August. And someone told me and they asked me that you should also come. So when I texted to the authorities there, they said, I said that I am a homeopathic nephrologist and I want to submit my abstract there. So then the reaction was that someone who is registered with MCI, they only should come. They are only allowed for the presentation. So I kept on requesting. So they said that, okay, we are providing you an email address. You write down everything, your concern, and then we'll have a discussion on that, and then we'll get back to you. So they haven't responded. I mean, I can go and attend the seminar, but as far as my abstract presentation is there, they haven't accepted that yet.
This is the problem with we people. The scientific community believe that we are unscientific. That is one of the reason. But
Yes.
the evidence proves otherwise. But they are not interested to look into that. But some of the doctors are very much keen to know what is happening with the other systems, and they try to utilize. We know a lot of doctors advices for Ayurvedic preparations for some of their illness, and they even directly give them those things. But most of the since homeopathy is a different kind of system, they cannot do anything with the homeopathic medicine. That's why only very few people allow the patient to take homeopathic medicine. But nowadays, there is a trend in Kerala that the hospital itself write on the last part of this their letter pad, they are writing like this: do not take homeopathic or Ayurvedic medicines along with the allopathic medicine, like that. So
Yeah.
that means that people are reporting to them that I took this medicine for so many years and I have so much of relief. And if the patient is going to the other system, definitely they are the losers. And not even the doctor may not be the loser, but the medical company is a big loser.
Yeah.
Uh,
Actually, I would want to interrupt you over here. The important thing over here is that this is the era of integrative medicine. The COVID has definitely proved that. That is the best example. Actually, COVID is the best example for that. But the homeopathic doctors, they do not know their limitations, which is very important to identify your limitation, and you should know that when do you have to refer a patient to a higher center or maybe to a specialist, so as not to make a fool of yourself. If the patient is having very high, say, potassium, being while suffering from renal failure, you have to send, either you start something to reduce the potassium, or you have to send him to a hospital where they can dialyze the patient and remove the excess potassium, because the potassium is the most lethal of all the things, of all the parameters of renal failure. So if the patient lands into a heart trouble, then you are the one who's supposedly to be blamed, because you should have taken a step. This was an emergency and you should have treated it like an emergency. Why instead of continue to give your medicines, you should know that when you have to refer the patient.
Yes, definitely. We need to know when to refer, whether to continue, what kind of other management required for the betterment of the patient. If we allow our patient to take some IV drips and all those things along with our medicine, the recovery rate will be much better than what we are getting now.
Yes,
Even
and we won't be a laughing stock actually. Then we won't be labeled as, being practicing placebo therapy.
yes, yes.
That is what practice of medicine is about. It tells you your limitations.
Yes, but we have every system has its own limitation, but that is the nobody is thinking about the limitation, but everybody is saying that I can do 100%, whether it's a homeopathic
Yes,
doctor, even
that is the
orthopedic
problem.
doctor, what I have noted in Ayurvedic doctors, they used to contain themselves, but we as homeopaths and the allopathic doctors have thinking in other way, other terms. That may be the reason. But of course, we need to utilize all those things, and that's why the Indian government put forward a suggestion of integration of all this medicine under one umbrella, and that was by Dr. Anpumani Ramadas, was the minister at the central scheme, but almost the northern state accepted the things, but when it reached to Kerala, here IMA people rejected the idea, and they told that we will not allow anyone to sit with us. You can have a separate thing. That's why a system called Aish has open. Otherwise, there is no need of such a different group of people sitting in a different side. But frankly, in Kerala, things are different. We have a lot of more than 1,000 homeopathic dispensaries under government control, more than 40 government hospitals, 5 homeopathic medical college. All the 40 hospitals have more than 25 to 50 beds. That itself will show the strength of our hospital, homeopathy.
Yes, sir. I was surprised to see the strength of the patients at the government hospital of Trivandrum also. There were so many patients and those who were actually undergoing treatment, and they were actually admitted there. It was so good to see. And even in Sharda Krishna, I had been to Sharda Krishna also, and this White Memorial. So it was actually great to see that so many patients trusting homeopathy and getting admitted to take homeopathic treatment. So if we go by this way, then definitely in some time we will have like running OTs and dialysis machines and all of these in our hospitals, so that the patient does not have to run anywhere else for emergencies.
Exactly. And now I invite Dr. Rambariswas to say few words.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. LUBNA Kamal Madam. Very nice presentation, very good presentation. WHO guideline quality of life. Other system of different types of emergency cases. According to homeopathic quality of life, angle of treatment. Angle of treatment, symptomological angle, miasmatical angle, and pathological angle. So, symptomological angle is the easy treatment of homeopathic science, and miasmatical angle, chronic cases, such like curative way of treatment, and pathological angle, the very difficult angle, a structural change. So, pathological
Sir,
angle.
that is what this session was about. That no matter how complicated a case is, you can still improve the quality of life with proof. And you can prove it also.
Evidence based.
A homeopathic doctor can prove it as well. That yes, I have improved the quality of life in a last stage cancer patient.
Yes.
And with Similimum, it is very much possible. We all might have experienced such cases that when there is hardly anything to be done in a patient, but still you can give them medicine and the quality of life definitely improves with homeopathy. This is
Yeah,
something
yeah.
I can say with surety. I'm 99% sure in almost all of the cases.
Yes, yes. Very, very thanks, Dr. Lubna Kamal. Thank you.
So
I
this
am agree for you.
this questionnaire should be mandatory. This should be taught in to students especially, because
Yes.
this is actually a research tool and
Mm.
which is almost free. You have to put some time, 10 minutes of your time, and you get such a good base to write a research paper.
Yes, sir. Yes, sir.
Yes, yes, yes. Thank you. Sure. Thank you.
Now I invite
Okay.
Mr. Ahmad Hassan, sir, to say a word of thanks to the session. Please unmute. And, oh, doctor is not available, so network is poor. Dr. Lata Manoharan, please say a word of thanks to the session.
Thank you, Dr. Danesh and Dr. Lubna Kamal. Very, very thank you to you. We are very inviting. You are very, very excellent presentation and wonderful it is. And on behalf of IFPH, me and all those who are attending the session, thank you for you. And come again, and we want more and more from your side. Okay, thank you,
Thank
sir.
Thank you. Thank you. Thank you. Wow. Very good.
Thank you, Dr. Lubna Kamal, and all those participants in this session. We can we can meet tomorrow at the same time with Dr. Another doctor will be taking a session tomorrow at the same time. Hope all of you enjoy the session. Thank you all. Good night.